First of all, thanks, guys. I'm so happy today to have finally, after all of these years, knowing each other via virtually on the telephone, via email, and on television. James Sapirstein, of course, President and CEO of First Wave Biopharma. Welcome, my friend.
Thanks for having me.
So all of us, so we happen to have like 2 or 3 biopharma guys this week, because whether you're watching us in New York City or you're listening to us in Ghana, as Mike likes to call home, or you're listening to us on the radio here. We broadcast out of San Diego, which is a biopharma, biotech center of the universe. What's the conference you guys are all attending right now?
We're at the Bio Conference, which is the international conference.
Yeah, and do you come here to get the word out, or do you come here to meet investors, or do you come here to participate with other companies?
All of the above.
No kidding.
I'm on the board of Bio as well, so I'm part of the organizing group.
No kidding.
But yeah, it's a very important meeting. We have 14,500 people.
And it goes the whole week here?
Through Thursday.
Through Thursday. They have a big party afterwards? Or you guys just all run home and start gathering the information that you took notes on?
It's been a party every day.
There you go. Hey, you were the first person to bring up to us on the air the need for COVID therapeutics versus just vaccines. And of course, vaccines were the front line, and we've heard the story. In fact, we even talked to David Dodd about the vaccine side. But the therapy side has been, I think, up until now, largely overlooked. And I think now it's coming to fruition that we should have been looking at this from the very beginning, right? Talk about that.
Well, that's right. There's really only one therapeutic on the market, which is Paxlovid. I hope I'm pronouncing that correct, from Pfizer. And people who are diagnosed with COVID are now being put on that. But it's still not the panacea. It's got all sorts of side effects. Young people can't take it. So we need more drugs.
So what's the big idea with First Wave Bio? What are we trying to accomplish here with the therapeutics?
Well, for us, with COVID, unfortunately, we didn't show any antiviral effect. We've published that already. We are looking at long COVID right now to see if we can help with some of the GI-related effects. So that's really our involvement in COVID. It's not as significant as we would have wanted it to be.
But the idea, when we first met, though, it was inhibitor colitis and pancreatic enzyme and a number of cystic fibrosis patients and so on and so forth. Have you pivoted from that?
No.
What does the next 18 months to 2 years look like?
No, I'm going to give your viewers an exclusive.
Perfect.
My board hasn't even seen this slide yet, but we're able to demonstrate that we've reduced our cost of goods on our enzyme by 80%.
No kidding.
So now we're very competitive against any competitor in the market, and then some.
Where are you guys at in the arc of the story with the FDA? Talk about that a little bit.
Well, FDA wants to see one more study for the enzyme. We'll do a bridging study towards the end of this year. It's very economical. It's only $1.2 million, which is fairly cheap for a clinical trial. And then we're able to go into phase 3. They'll probably ask us for one more trial, and then we're ready to be approved.
James, talk about when you guys get to the 3-yard line, you're out of your clinical trials, you're ready to getting very closely to take this to market and even market it. Do you take the approach of you're going to hire your own sales staff, or you're going to hopefully get purchased by or at least this therapy gets purchased by a bigger biopharma? What's the strategy, or do you have to wait and see?
No, we are, I can tell you, that's what I've been doing all week here, is talking to potential partners. We are going to look for larger pharmaceutical companies. I just came from a meeting just when I was traveling here.
Sure.
We met with one of the largest pharmaceutical companies in the world to talk to them about partnership.
And notwithstanding, and I asked this of another guest earlier today, you guys were in business marching forward pre-COVID. Life existed pre-COVID. Not everything has to do with the COVID therapeutic or COVID vaccine. And that's what I wanted to transition to. So I think the future is actually brighter not to be, from what some of these companies that I read about, even speak to, as a one-trick pony, that you still maintain some of the things you were doing pre-COVID, right? I mean, and I think that's going to bear some fruit for you guys in the future. What's your opinion on that?
No, that's absolutely correct. You talk to any investment banker, COVID is finished. There's not a lot of upside left. So luckily for us, we do have all these other indications. As you mentioned, checkpoint inhibitor colitis. We have ulcerative colitis, ulcerative proctitis. And even the big pharma I just spoke to, we're looked at as a pretty good developer of gastrointestinal products.
Hey, let's talk about, by the way, James Sapirstein, for our radio audience. You can't see him in his graphic here. James Sapirstein, of course, Chairman, President, CEO of First Wave Biopharma. They are publicly traded under the stock symbol FWBI. You can go to firstwavebio.com .com. Talk to us a little bit about, as a country right now with the FDA, there's other diseases. As I mentioned earlier in the program, my mother and my daughter both suffer from MS. You hear every day about things other than COVID. Is the FDA rounding it up equally, or the resource? And I know it's tough for biopharma. I don't want you to be critical of the FDA, but in your personal opinion, how are we doing as a country in terms of developing those drugs?
I don't mind being honest about what's going on with the agency. I think the public deserves to know. I think we're in a tough spot. Rob Califf, who's a great FDA commissioner, is taking his direction from the White House, which is very anti-pharma. As we all know, they blame us for inflation and all those other things, which is absolutely untrue.
Well, it could be worse. You could be an oil company.
Yeah, it could be an oil company, exactly. But right now, I can give you statistics that the FDA is reviewing over 500 compounds for pancreatic cancer.
500?
500. The chance that any one of them makes it is almost nil.
No kidding.
And yet, for stroke, they're reviewing only 30 files for stroke. So that's what you're competing with, and it's different divisions. So yeah, I think all the other therapeutic spaces are having issues competing with COVID and also competing with cancer, because a lot of the venture capital companies, they like to have the big home runs.
Sure. Right.
So that's the problem.
But isn't criteria specific therapies for? Look at it. I say this all the time. If you are as Mike Costa is, he's an enthusiast. He likes to knit sweaters for his cat. There's maybe 10,000 people in the world that are enthusiasts about knitting cat sweaters, right? But if you had a way of reaching all of them and putting a radio program on, Mike Costa's cat sweaters,
I will do it.
Those guys will pay $20-$30 a month to listen to you talk about that.
Yes.
Isn't it better to be criteria specific with maybe not such a massive pandemic type of therapy versus maybe honing in on the pancreatic enzyme or honing in on the inhibitor colitis and such? I think you're in a better spot, personally.
I think it is. And if you listen to people, my colleagues, the other CEOs, we believe things are pretty messy over there right now. It took them a very long time to bring Rob Califf in, and he barely passed the Senate vote. There's a lot of straightening out to do. A lot of the divisions are in disarray.
Last question for you, and of course we love having you on every week, and anytime you come to San Diego, you're welcome. I want to know how you think we're doing now with COVID, because you kind of called everything months ahead of time. You're the one who told us about the Omicron virus before it happened, 3 months before. Where are we right now? Are we endemic, pandemic, or are we just big question mark still?
I think we're definitely endemic. There is another wave that's coming. It'll hit us by September.
No, every time he said it has happened. So I hate to be the bearer of bad news.
Hopefully it's not going to be as bad.
Yeah.
But it's coming from the south, so they're in their winter phase right now in the southern hemisphere, and then that's going to come back up here.
James, thanks you so much. James Sapirstein, of course, is the chairman, president, CEO, First Wave Biopharma. This segment brought to you by First Wave Biopharma. How do you like that?
And Costa's cat sweaters.
Yeah, CostaCatSweater.org. FWBI is their stock symbol, of course, and we'll put that out to our 100-some-odd thousand TikTok money fans. More Big Biz coming up. Stand by.